Welcome to Closeup on America's Business, the program that takes you inside some of the most unique and successful companies in America. I'm Jim Masters. On each edition of our show, we introduce you to some of the most innovative business leaders in the country today. You'll discover what their products, services, technologies, and business models can do for you, what they're doing to change our world and change the way we do business.
It's the most natural and beautiful thing in the world. Two people fall in love and want nothing more than to start a family. And what could be more exciting and miraculous than the birth of your own child? For many, this is the fulfillment of a dream, but that dream remains elusive and even heartbreaking for many couples who struggle to conceive. Well, we're here today to tell you, don't give up hope just yet. We'd like to introduce you to some people who just might be able to help. Hi, I'm Janice Marie, and we're here today in Staten Island at Island Reproductive Services. This is Staten Island's only full-time fertility practice with a talented team of doctors and an amazing staff who use the most up-to-date technology with one goal in mind, and that's to help you have your baby. The results are nothing short of miraculous, and in fact, many of those miracles have been running around this office all morning. Let's take a look.
Island Reproductive Services is a place where women and couples can come in a comfortable setting to help achieve their goal of having a child. And when you're younger, it is very easy to have a child. But with women delaying childbearing into their 30s and some even into their 40s, it becomes a very difficult thing because nature wasn't set up that way. Nature was set up for women to have their highest fertility in their late teenage into their 20s, and it declines once they reach their 30s. And as a woman gets older, and her ability to conceive declines, let alone any issues that there are with the partner, because it does take two. The most common reasons that somebody comes in is either a low sperm count in the husband or partner and advanced maternal age, a woman who's 35 years and older. Other secondary issues include women who don't ovulate well or produce eggs well, and women who have pelvic adhesions and scar tissue from endometriosis and previous sexually transmitted diseases.
My husband and I have been married now for 9 years, but we've been trying for about three and a half. Supposedly we went for tests, nothing was wrong with us, and my OBGYN recommended that's not gonna happen. I was with him for about 3.5 years, and we did insemination, thinking we'd never get to the in vitro, which we did. After 3 miscarriages, finally, beautiful children, and it's just a whole new world. Every day is like a learning experience, and if it wasn't for them, we never would have gone through all of it.
Most couples are very stressed when they come to our office. They have been trying potentially for many years to have a child or for a small amount of time, and it is very difficult to anticipate how any given couple reacts. We try to simplify the process. We try to make them understand that couples need to support each other. We try to make them understand that everyone in the office is working for a single goal, which is to help them out in whichever way we need to. So we try to gauge on the first visit where each individual is coming from and individualize their treatment in order to make the atmosphere less stressful and easier for them to get through.
What are some of the other treatments you can offer your patients?
We attempt to tailor every treatment to their individual diagnosis and their individual needs. That being said, there are a number of treatments that are common for many different couples. They range from simple treatments involving oral medications with or without more advanced therapies that varies from patient to patient. Some patients require more minimal treatment. Some patients may require intrauterine inseminations of sperm. Other patients may require very advanced therapies, in vitro fertilization, even genetic therapies.
I came to Dr. Nakenhauer, I would say about 5 years at least, and with endometriosis problems. And I couldn't get anybody to really help me, and I wanted to have a baby, and he said, you will have a baby. With one ovary or not, you will have a baby. And we did, and I did in vitro because the IUIs didn't work, but I put one embryo back, and this is who I have. I had a stomach problem, and the stomach doctor thought it was my endometriosis. And he knew it wasn't, because that's not where the pain was. It was around my belly button. And I called and I told him I had such pain that I think I'm gonna have to end up in the emergency room. He admitted me under his name, because he knew I was in a lot of pain. And he said, you'll see my attending doctors and I'll be there. And within 2 days of being there, he saw that my counts weren't good, and you know, it was elevated, and he knew he had to do surgery, and he opened me up, and my bowel was dying, and he gave me a bowel resection, and if I didn't go when I did, or he didn't open me up, I would have died in 2 days. So to me, I owe him my life.
The job of an embryologist is to make sure that we take care of starting from the eggs, creating an embryo, growing it, nurturing it until it's ready to be implanted back into the patient. And hopefully we would have an end result with a great baby. And that's what my job is, to make sure everything goes according to what it should be. It's very technical. It involves a lot of steady hands and a lot of work. Doing the embryology gives us a lot of pleasure too, because the end point is when we see the babies, and when the patients actually bring them back to us. I mean, it makes us feel that we've done such a great job, and we've had some great results. With my own personal experience, my daughter has been through this and created beautiful babies out of it.
We're trying for a couple of years, and then we decided that we wanted to take a more aggressive route as far as having children. So we decided to see Dr. Nackenhauer. Very pleasant to work with, very comfortable. He explained everything very thoroughly. Luckily, it worked right away, so we can't complain.
I'm on the phone constantly talking to the patient, and also many times to the husbands. Many times they'll be calling also, they want to be involved and they want to know what's going on. So in the beginning they're usually a little embarrassed, intimidated. I try to make them feel comfortable and know that they can call and ask the questions also, and that I will help them out. And there are many couples that the husband does call for the wife. If she's not available, she's in meetings, the husband will be calling for the patient instructions, and I will tell them, and they want to be involved. And even with the injection instructions, I'll be teaching the husband sometimes instead of the wives, because they're afraid to do it, or they just want him to be a part of it and he wants to be involved with the whole process. By the end of the day, it is a privilege to have been working with these patients, and it makes me feel special to have been a part of their life and to help them realize their dream of having a family. And knowing that without coming here, that there is a possibility that they would not have children.
My husband Glenn and I were trying to get pregnant for several months, and after we had no luck, we were referred here, and it turned out to be the best thing that ever happened, because when I met Dr. Nackenhauer the first day, he spent so much time with us going over our case and just really making us feel comfortable, like this was the right place for us. And we did the IVF, was the first step with him, and we had one embryo, and we have one beautiful little boy, Connor, who was our first try at the IVF and was a wonderful success. And a year and a half later, we decided it was time to try again. We wanted baby number 2. We had so much fun with him. And we came back, and our second try was a little rougher. We did IVF 4 times.
There are a lot of fertility clinics in the New York metro area. How do you set yourself apart? What's different or special about you?
At Island Reproductive Services, we do so much more than just infertility. Although infertility is the majority of the practice, we cover abnormal puberty in young girls all the way up to abnormal menopause or difficult menopause in women in their 50s and 60s. There are gynecologists that refer to us just for our surgical expertise in dealing with multiple issues, including uterine fibroids, pelvic pain, endometriosis. Couples and women come in anxious, worried that although they've been successful in many avenues of their life, this is the one avenue that goes to the core of their being and they're unable to succeed. As such, when we set this up, the idea is to make the couple as comfortable as they can be and provide them all the information that we can provide them so they can make their best choices for which is the best avenue to proceed.
If it's your dream to have a child, maybe you just need a little help. And just maybe, Island Reproductive Services can help you. Here's a sample of some of their miracles. Reporting from Staten Island, I'm Janice Marie.
That concludes this edition of Close-Up on America's Business. If you'd like more information about any of the companies featured on today's show, please visit our website at closeuptvnews.com.